My name is Arthur. I guess I'm the host of this panel here, of my colleagues, as well as one who's, again, to join us, not listed here. Alex, Christina, and Lindsay are both here, and they're all um, PAs or PA students in different level of their career. And we wanted to talk to you guys about, sort of our journeys and where we see everything going, and then talk to you guys about any questions, any burning questions you might have. And, I'll start by just some simple definition. What is a PA? And we go by many different names now. And I think more recently, they've changed it to a physician associate. But in other places, you can be an ACP, and an advanced clinical provider, or advanced practice provider, or a mid-level provider. And my definition of PA is very simple. We're awesome. That's what we are. And if you don't believe me, you can believe that we're the best job in the country this year, and often top three in previous years. But this is not just something I'm making up here. This is truly, we're awesome. This is a great profession. It's been growing, and it'll continue to grow. And for those of you who are interested or looking into it, you're going in the right trajectory. What else what else is a PA? Well, a PA is, in my opinion, adaptable, malleable, and flexible. And what I mean by that is, and I'll tell you about my journey is, this is not where I thought I would be in high school, but I went into it, and I was able to accommodate the lifestyle. And where PAs are very easily taught, they're malleable. I love teaching students and new hires, because the enthusiasm is very high, and very open to being taught, and we're flexible. We'll talk about how you can change professions, specialties as a PA, and you can go from one role to another, or one area to another within your institution, within your state, within the country. And so a PA profession is very desirable for many of these properties. We're psychotherapists, okay? And what I mean by that is, we're physician assistants in name, and we assist physician. And doctors, I don't know if there are any on here, I can't tell, but doctors are big babies. They're geniuses, but they need to be, they're such geniuses that they can't handle some of the little things that we help them with. And very often we play therapists to them and our own colleagues and our patients and our families, because that's just a role that we fit very well into, because of the way we're educated and the way we are as people up front. Okay, just be mindful you're not legally a psychotherapist unless you're specializing in therapy. We're high urgency problem solvers. I tell people, give me 5 minutes, I can do 10 things. There's a lot that we can do, and our jobs, at least in a hospital environment, I find our jobs are problem solvers. We're here to figure out how to get things done quickly and efficiently, because lives. And we often have to find alternate ways that are both effective and not inappropriate to get things done. And we're very, very good at that. And I often get myself in trouble in real life, because I'm asked to do something, I'll do it in a heartbeat, and somebody will change their mind. I'm like, I did that already. That's just, my brain is already doing it. Sorry about that. Doing it before somebody even made up their mind to do it. So that's just who we are. And if you're a New York City kid, you know what it means to be constantly busy and on the move. We're translators. I mean, we're not, again, not legally translators, but we're translators in the sense that we're mid-level professionals that bridge the communication between doctor speak and layperson speak. And we spend a lot of time with our patients, educating them about what's going on in a language they can understand. And we fit a huge role with that. That's really, really important, because again, doctors are geniuses, and sometimes they forget that. You tell somebody about the medulla oblongata, they don't know what that means. Most of us still don't, but that's that's what we do. And of course, we're lifesavers. I mean, at the end of the day, we're doing patient care, and we do say we have the capacity to save lives. We pick up on things that some people might miss or somebody else didn't see. There's a lot of checks and balances at work, and we do have the ability to really make a difference in people's lives on a daily basis. So, what about me? You can see here from the picture, when I was a PA student, my clinical year back in 2000, who knows when. I've been doing this for a little while now. I consider myself a bit more of a dinosaur with this stuff. And, my colleagues here are, younger in their careers, but I've been doing this a while. And, my journey through this is really boring. And I say that because it was a long time ago and the profession has changed and how you get into it has changed. And I would, I couldn't hold a candle to most of the students that, rotate with us now because, I did culinary in high school. I did cooking, and that's what I was going to do. And my culinary teacher told me, "Hey, why don't you do this PA thing?" And I'm like, "Okay." Yeah, it was just that simple of a decision. I never stepped into a hospital until I was a PA student, and I got to say, this is a very happy. I couldn't have had a bigger happy accident than this, because here I am now, and I wouldn't have traded it for anything. And I think it's really fantastic. And now it's a master's program. I only have a bachelor's because of how things were back in the day, and I'm very lucky to even gotten into a program given how incredibly competitive it is to become a PA these days. And why did I even choose neurosurgery? Again, my decision making back when I was a wee lad was, oh, brains are cool. And that's what it was. And like, oh, well, the brain's this like unknown thing, so let me go into it. And it was a complete misconception, because what I actually do is very different than what I thought I would do. But again, going back to that first slide of adaptability, we're very adaptable. And I adapted to the environment. And where am I now? Well, now, having been a PA for so long, I wear a lot of hats. Besides being a neurosurgery PA that involves, being in the OR and doing critical care and just working and seeing consults in the ER, I've also subspecialized within the field into neuroendovascular. And that, if you guys have been on the Brain Turns talks, you'll see there's a lot of work we do with opening up blood vessels or treating aneurysms right through just an X-ray. I'm also a supervisor within our department. Our departments are very big, and I'm in a, that's where that psychotherapy also comes in, is I'm in a supervisory role where I deal with a lot of more administrative stuff. And I do that with my colleague Vadim, because our team is so big. And I also this year have become the preceptor for all the PA students in the hospital, because I've always precepted the neurosurgery students like Lindsay. And I've also done a lot with the shadowing, which has been very difficult with COVID this past year. But I'm now also in charge of all the PA students, and I get to put my little mark on all of them, I hope. And I'm also your entertainment for the hour. Not less important, but still many hats. PAs do very many things, as you'll see from some of my colleagues. And what does the future hold? What do I think the future holds for myself and for the profession? This is not a day job. It's not you can have a 9-to-5, but it's not a 9-to-5 role. This is a career. It's a lifelong growing, process. And you can see, as I've picked up a lot of these extra hats over the years, and I'm now dabbling in education and administration. I don't know where I'm going to go with that. Our former chief, Oleg, moved up the ladder, is now a CEO of a rehab facility as a PA, and that's really cool. There's, that ceiling is very high. We really don't have a lot of limitations other than our own motivations. And just before I move on to all my colleagues, is my tip for applying for anybody here who is interested in PA school is, I think the PA acceptance rate, at least I know in the New York area, is about 5%. Okay, the program that many of us have went to is very different now, and there's about 75 slots for like 5,000 applicants. So apply to a lot of programs. The more programs you apply, the better your odds will. Don't worry about the fees. Don't let the finances restrict you. PA schools also are very expensive now. Who cares? You'll pay it back. It's not a big deal. Don't let that limit you. And of course, help the community. If you're doing this, do it for the right reasons, and you can show that. And when you're applying, by showing you've done some community work, because shadowing is a little harder now. And I think you can balance that out with things that you do out there that are not necessarily medicine, but still show your devotion to people. And now I will pass this along to Alex.
Hi, everyone. My name is Alex. Also a PA. I've been working for about 2 years now. I'll get into that later. But first, why did I want to become a PA? To be completely frank and honest, I wanted to go into medicine, but I didn't want the 8+ years of med school, residency, fellowship. For those of you who are watching who are pre-med or are currently in med school, I have the highest respect for you, power to you, but it just wasn't for me. Like Arthur said, being a PA is a very flexible and versatile role. With my job now, I have the I only work 3 shifts a week, days and nights, sometimes weekdays, weekends. So I have 4 days off a week. You know, obviously this is different for different types of jobs, but overall you pretty much have your pick of what kind of job you want to do, what kind of schedule you want to have. And being a PA also allows you to work in different specialties, unlike in med school when you're kind of locked into your specialty wherever you match for residency. And so the two of these things together create a really great work-life balance. And I love the lifestyle of being a PA. As far as why I chose neurosurgery, sort of like what Arthur was saying, I just found neuro to be very fascinating. In college, I was a psych major and sort of had some neuroscience overlap. And the first year that I was in PA school, we had this program where we got matched up with a PA in the area to sort of do like a pre-clinical rotation shadowing experience. And I happened to get paired up with a neurosurgery PA at GW Hospital in DC. And kind of similar to the service that we have here, I was in the ICU with him, endovascular, the OR, the floor. So I got a little taste of everything. And I spoke to him a lot about his career and why he chose neurosurgery. And that kind of sparked my interest. And my second year of PA school, during rotations, I did an elective rotation in neurosurgery. And they were just a group of like badass PAs, the same thing, ICU, OR, ER consults, the floor. And it was a very hands-on rotation. And I got very lucky. I was able to first assist as a student. That's very rare. And I fell in love with it. So that's why I'm here now. Neurosurgery is a very challenging specialty, especially in the inpatient setting where we are. You know, critical care is hard. Medicine is hard. And there's also the emotional aspect of it. You know, patients don't always do well, and we deal with death a lot of times, unfortunately. And it can be very difficult to deal with these patients and to deal with their families. But at the end of the day, it's such a rewarding field. The gratitude that we get from patients and their families, and especially those times where we see a patient who's comatose, who eventually comes in as a walking, talking, functioning person. There's just nothing better than that. I love working in the inpatient neurosurgery setting specifically because we get a really good mix of critical care working in the ICU. We also get to do a ton of bedside procedures, and we also get some OR experience and also just experience working on the floors. So a little bit about how I got here. During college, because for PA school, you need like patient hands-on hours. So I worked for a company that did autonomic and pulmonary function testing. They sent technicians to various outpatient settings, particularly primary care, some pulmonology offices, some neurology offices, cardiology. And so, you know, I was trained on how to do these testing, and I got, you know, experience doing that. For PA school, I went to George Washington University in DC, 2-year program. I went straight from college. Very difficult 2 years, but I did really like the program, and I think they, you know, prepared me as well as I could have for the real world. And since graduating, I've been working here at Lenox Hill in the neurosurgery department. More recently, I have gotten involved in some clinical research with Dr. Bookbar. I'm not sure if he's done previous talks on some of the research that he's doing. Particularly, I've been involved in the mental flap study, which is very cool. If you guys Google it, you can read a little bit more about that. What the future holds for me, I mainly, you know, I'm still relatively new, 2 years. I'm still learning so much every day. So I'm just excited to continue learning. We recently restructured our department to have these various senior roles that Arthur sort of touched upon, each one sort of managing a different aspect of our service. So there's someone who kind of manages the ICU, the floor, discharges, the education. So, I'd hopefully like to fill one of those roles one day. Arthur, if you're listening, feel free to promote me whenever you want. And I'm also really excited to see where my participation with Dr. Bookbar's research goes. As far as having an administrative role one day, maybe, I don't know. But that's the great thing about being a PA. There are just so many different options. It's not just the clinical work. And my tips for applying to PA school, like Arthur said, apply everywhere. It's very hard to get in, and the more places that you apply to, the better your odds are. Also, don't let the rankings of schools hold you back. Apply everywhere. GW, it's a top program in the country, and I got rejected from some schools that are like the lowest ranking. So you never know, just don't limit yourself. Shadow PAs if you can. I know with COVID, maybe that's a little bit harder now. Understand the role of a PA, understand the job. Not everyone knows what a PA is. And if you can really talk about that in depth on your essays or in interviews, it'll really help you to stand out from the crowd. And most importantly, be authentic. Being a PA means you're a people person, and schools want to see that. Your grades are important and your essays important, but try to show them a little bit of your personality when you're on interviews. I know it's scary and nerve-wracking, but if you can show that you're, a relatable human being, it's really going to help you out. And for everyone who is planning on applying, I highly recommend buying this book. I'm not being paid to say this. It is not an ad. How to Ace the Physician Assistant interview. I swear this book got me into PA school. It is so helpful. And yeah, that's all I got.
Thank you, Alex. Oops, too fast. Christina.
Hi, I'm Christina. I picked the PA profession for some very similar reasons to Alex. It's really a great practical application of science in medicine, and I really love the role that PAs play in patient care. And there's so many opportunities for growth within the PA realm, opportunities for growth, for change, for flexibility as you progress through your career. Prior to PA school, I was a volunteer in a CCU, and that was my first exposure to medicine. And it was where I fell in love with critical care. I volunteered in an ER, and then I worked as a nursing assistant on a stroke unit, which was really great hands-on experience. It taught me how to talk to patients, how to care for them when they're in challenging times, and how to interact with family members. But it also exposed me to a variety of settings where I got to see what the role of a PA is in inpatient settings, in an emergency room setting, and it was really great. I picked neurosurgery. I picked a neurosurgery rotation in school really out of curiosity. It's a topic that's kind of skimmed over in PA school sometimes. And so I was curious and I wanted more experience. I knew I liked critical care. I had MICU and SICU rotations, and I was, but neuro ICU is a little bit of a different experience. So I wanted to maximize as much time as I could in critical care during my rotations. And I really surprised myself with how much I liked the OR. Neurosurgery, especially at Lenox, is such a good mix. It's, as Alex cited, bedside procedures. You're doing EVDs and central lines and arterial lines and lumbar punctures. But you're also, a huge component of any ICU is medical management. These patients are sick, and you rarely have a patient, even on the floor, that has just the one thing wrong with them. You're taking care of multiple medical issues at the same time. And so it's a really challenging and really rewarding experience. And then rotating with the team at Lenox, the PA team there is really hard to beat. They're a really wonderful group. And so they made the decision easy for me. So I've been at Lenox Hill for 6 months now. I work in the neuro ICU, we work on the floor, and then we staff consults as well. So it's a nice, diverse experience. And it's cool to be part of a growing department. You want to be part of a team where there's opportunities for growth and for expanding your role. And I think we have just that at Lenox right now. In terms of the future, I think for me personally, it's a lot of learning. I come home from work every day realizing how much more I have to learn. But I think it's important to be you know, in a job that challenges you and that pushes you, and where you're not coming home bored and feeling like you haven't mastered. So I'm enjoying it. I know for me, from, you know, pre-PA to even now, you know, you have mentors along the way who are pushing you and impacting you, and it's been really wonderful to have these educators and mentors in my life. And so I would love to eventually pursue a role in PA education, you know, in a formal setting in a PA school, but eventually like helping to precept students more on their clinical rotations too. And then hopefully more time in the OR going forward, because that's something that I really enjoyed during my training. And I think as a profession, I think, you know, being a PA is whatever you want to make it. You have PAs who specialize and do one thing really, really well for their whole career, and that's what they love, and that's great. But you also have the opportunity to keep it really broad and to keep your practice, you know, keep your experience broad in your practice so that you can do a variety of work, which is exciting for other people. So it's whatever you want to make of it. I think one thing, you know, Arthur talked about how PAs bring flexibility because we can adapt and change and grow so easily. But I also think PAs bring a unique stability to inpatient services. You know, it's not like residents where they're rotating out every few weeks or months or years. You know, these are people who stay here for years and really help to bring stability to departments. And I think that that's unique to our profession too. And then in terms of tips for applying, I think it's just important to understand the role of a PA and why you're pursuing PA school and not a medical degree and not a nursing degree. Like what makes the role of a PA unique and what makes you, like what's your desire to become a PA? And I think it's important to get involved in your community, even if it's in non-medical roles, because programs like seeing well-rounded applicants.
Thank you, Christina.
Thanks.
Well, I want to let our Fatima Jara, who is going to share her slide before I continue on the one I have. Fatima, you're
Yes, one sec.
stop sharing and let you introduce yourself.
Can you guys see my slide here?
Yes.
We can see it.
That was easy. All right. Hi, guys. I'm Fatima Jara. I am one of the colleagues of the three people you listened to just now. I've been a PA about 4 years, and I've been working in neurosurgery, and I love it every day, or not every day, but like I love it most of the time. And there are days that are challenging, but when I come back home and I think about my profession and you know, whether I have a meaningful, you know, career, and I always come back to the conclusion that I do. So I've been noticing some of the questions. I'll just start by saying where I went to school, because I think that some of you are interested. I went to St. John's University, and as you can see, this profession is an evolving profession, and not all of our training and, you know, pathway to become a PA was same. So my program was a bachelor's program, and I went straight from high school to my college, and it was a program that I had to like get into as a bachelor student, and then continue on to the certification program. So it was a combined program. I did not need to apply, but I needed to have those extra clinical hours during my bachelor years. So I ended up doing research at a hospital in Boston. So that was pretty much my route. It doesn't help most people now because that's no longer the case. But that's just to show that the process might change in the coming years. Why did I become a PA? I have always had passion for medicine. I, you know, loved learning about, you know, pathologies and human body systems and how it works, and biology. And I'm sure a lot of you guys are also interested and thinking, oh, can I do medicine, or am I fit for medicine? And I just went with my interest, and I looked into the medical, options for where I can do that. So I looked into medical lab specialists, I looked into medical school, and I looked into PA school. And I actually didn't know about PA school until I applied for a pre-med program, and I heard about the clinical involvement, the interactions with patients, and the amount of work-life balance compared to a medical doctor, the length of training, all of it together. When I heard about the PA profession, I was like, this is it for me. I'm going into a PA program. So that's the reason why I chose to become a PA. And I also noticed that as a PA, you're basically sky's the limit in terms of which profession you want to work in, which specialty you want to go into. You can do surgery, you can do derm, you can do palliative care. Like, in the spectrum of specialties and lifestyle differences you have in PA, in the PA profession, and your ability to choose was a very enticing aspect of it. As a medical doctor, basically, if you don't get matched into the desired specialty, you're pretty much stuck with that specialty you got matched into. So neurosurgery, I was always fascinated by neuroscience and sleeping. I personally struggled with sleep stages. I had a personal journey with sleeping problems. So I would wake up in the middle of the night, and I would just like be scared and just like start screaming. And I know, as embarrassing as it sounds, but it's something that I struggled with. And I got super interested in the stages of sleep, and I learned more about the neuroscience. And that's how I got interested into neuroscience. And when I did my rotations, I picked neurosurgery because I was also very interested in the hands-on aspect of OR and procedures and things of that sort. So I think neurosurgery is a perfect balance of basically the medicine and hands-on aspect. So you're not, especially in our own service where we do neurocritical care and neurosurgery operating room. So we have exposure to both doing things hands-on in the operating room and also formulating plans and basically doing medicine as a neurocritical care PA. So that was perfect balance. And also what is very interesting is that in a neurosurgery unit, you get a share of everything. You could have a perfectly normal day, everybody's stable, you have a chill day, or you could come into work and everything's all over the place, or you go into work not knowing what's coming through the door, what's going to be the day's going to look like. So my other option was the emergency room, where that's what happens, and a lot of people choose emergency medicine because of that reason. They don't know what's coming through the door. It's that adrenaline rush and everything. So I think this is why a lot of us choose neurosurgery. It's a combination of all those experiences. In terms of where I am in my profession right now, I am I've been a PA for 4 years. So I'm comfortable in terms of my clinical skills, versus when I first started, it was like drinking from a fire hose. Like, you needed to learn so fast, so much so fast. And people and their lives dependent on it. So it was a tough experience. However, over time, you learn to, have a lot of these things as kind of like a muscle memory. You know how to do these things. You think about a lot of the interventions, and you just keep on learning and adding more and more and more to your experience. I do neurocritical care, as I mentioned, mostly, and floor management, pre-op, post-op, and also I scrub in with surgeons as a first assist. As a PA, there's another very interesting aspect that you may or may not know, is that a lot of us do per diem jobs. So we have a primary job and we pick up an extra job where we go in, whenever we want to. Basically, some of them might require you to have a minimum number of shifts, like 2 shifts per month or something like that. It's extra money. You get to work with other people. It's a little bit more chill because you're not there as a primary person, and it adds to your experience. So I also go to other hospitals for that experience, for that extra operating room hours. And in terms of my future goals, the sky's the limit when it comes to what you can do as a PA. So like everyone else touched base on it, you can go into administration, you can go into research, you can even go into entrepreneurship. There's so much in medicine that needs to be, that needs creative solutions, and there's so many avenues where you can find products, solutions, things like that you can introduce to medicine and work on it and be that pioneer in that aspect. So as a PA, your time is not so consumed that you can't think of these things. You have enough time to come home, think of this, and work on things that you'd like to introduce to the world of medicine. Someone asked a question on the thread, and I said I was going to, Arthur, you can take my screen back.
Sure. You can answer it in the chat, I think, or we're going to have a Q&A after this, but
Okay.
you can do it in chat while we keep going. So I think I'm back, correct? I'm back on Christina here.
We don't see your screen, Arthur.
You don't see my screen. Let me share my screen again. Nope, don't do it from the beginning. Okay. So, and Lindsay, who, I tried to, Lindsay Shanley she'll tell you about herself, but I try to get sort of a tier of people from someone old like me to someone who's actually still in PA school. So I will let Lindsay talk to you about herself.
Hi all. So I am a second-year PA student at Pace University. I have completed all of didactic year, which is the first year, 14 months of my program. And then I've completed about 10 months of my clinical year, which is 7 or 8 rotations. I'm 8 rotations completed, and I'm on my last rotation, which is my 9th one. And I have 1 month left, which is super exciting. So I want to go through a little bit about why I became a PA and where I am now. So for me, I was really conflicted. I came into school with a chemistry degree because I thought chemistry was cool in high school. And I thought I liked animals. So I was like, oh, I'm going to maybe try vet school. Then I worked at a vet clinic and a zoo, and I hated both of those. So then I was like, oh no, well, I know I don't want to do med school because I understand how long med school is and residency. So it's like maybe business. And then I tried business and I was like, that's terrible also. This is not for me. Missed the people and the science. And I was like, oh, I guess I have to go to medical school for me to get medicine and to be able to learn medicine. And then I was talking with one of my professors, kind of complaining about not wanting to go to med school because that's my only option. And then he told me about PA, and I had never heard of it before, but the 2 to 3 years getting to do about 80% of what a lot of physicians do, and being happy and being able to work in any field, it just seemed super alluring. And so here I am, and I'm super happy. Honestly, wouldn't take it back for the world. So when I first started PA school, I kind of had no idea what I did or didn't like. I was like, I think I like cardiology. I like the hard medicine. But actually neuro really intimidated me. I was super scared by it. I was like, oh, I don't really understand the brain. I'm just gonna not do. any of it. I'll like know it for the test, but I'm not gonna, try and like, I'm gonna work in something else. I don't need to learn about the brain. But then it was ironic because I was like, but I'm kind of interested in, I don't know, cancer. Cancer is also hard. So I showed up to Lenox Hill Hospital on my very first day of all of my rotations. And I was supposed to do a hematology oncology rotation, but it was in the peak of COVID. And if you think about it, those people don't really have any white blood cells. So they didn't want extra people coming into the unit. I showed up and I was like, hi, I'm here to start my hem-onc rotation. And they were like, we're not accepting students. So luckily, one of the PAs happened to be standing right next to me when I figured this out. And I was like, oh my God, what am I going to do? And her name's Anu, and she happened to be part of the Lenox Hill neurosurgery team. And she was like, we'll take her. And so that's how I ended up getting into the neurosurgery team. And lo and behold, I ended up loving it. It's super cool on our team, at least the way that we're organized is that we do the ICU, we do the floor, and we do the OR. Usually you kind of only get one set of those things, but we got to like integrate all of it. And especially it's sometimes a little bit more rare for PAs to be able to be in, especially a critical care setting, at least like new grads or shadowing. So I just thought that was a really unique opportunity. And I like the thing that, it's not just about the brain. Like, yes, of course it's about the brain, but you really have to know everything. Like all of our patients are gonna have cardiac issues. They're gonna have end-stage renal disease. They're gonna have so many different things that you have to manage. And I really like how integrated neurosurgery is and how much internal medicine was also involved. That's honestly like 60% of it. So right now, again, as I said, I'm on my final clinical rotation and currently studying for my boards. They're about 3 weeks after I graduate on August 13th. So wish me luck. And I'm currently applying to jobs. So, hint, hint, Arthur. But again, applying to jobs, and I'm really looking at neurosurgery and just all of like in critical care and neuro units because I loved how integrated all of the medicine was. And then for my, like in the future, for me, I knew that everyone else could speak a little bit more on the future of the whole profession because that just, they've just been in it a little bit longer, but I kind of wanted to speak on behalf of my future. My goal is to become eventually to become a part-time educator. And I really liked how at PA, you could quickly go from, of course, I'm going to work for a little while, but I didn't need to be in attending for multiple years to be able to start having students shadow with me and become a preceptor and then slowly work up to, I would love giving presentations in neuro for PA students. And then also I like the idea of potentially looking at doing a per diem job in a completely different field because neuro is hard on yourself. Like a lot of your patients don't do well. And that's just the reality of it. So maybe, some per diem and something a little bit more happy, like OB or something, so that, there's a little bit of balance at least. And, it keeps you on your toes for when you have to do your PAN-RE, which is the repeat boards that you have to take every 10 years now. So for applying to PA school, I say put grades first and experience second because your grades stay forever. Like you can gain experience, you're never gonna lose it. But when it comes to your grades, like if you slack off in the beginning or, you are working, so this almost happened to be working so hard at other jobs that you start doing poorly in school, you got to drop the experience. You really need to focus on your grades because your grades will always be viewed. Like if you get a C, it's never going away. And or an F or anything. So it's definitely best to focus on grades and experience second, and then take a gap year. You don't need to go to PA school immediately. It's already way shorter than med school. Enjoy your life a little bit. Every single one of my friends who did a gap year is so unbelievably grateful. I just highly recommend it. It just takes a weight off your shoulder. Also, you get more experience. You get to have some fun. you're just chilling, and you meet so many people and you actually learn a lot in your experiences before PA school that help you during it. And then finally, like some things that I'm trying to go through right now that I think are really important when you're looking, once you're in PA school and kind of like looking at your different interests, is the new grad job considerations. These are things that you should be thinking of when you like pick your elective rotations. So, you know, do you want nights and holidays, or do you want to be able to, you know, work, you know, be off every Friday at 2 p.m., you know? Do you want a clinical setting, like an outpatient setting, or do you want a hospital setting? Body system sounds weird, but like some people just really, you know, we like the brain. And then some other people really like, one of my friends who is a med student really wants to do pelvic surgery. And she's like, I just love the pelvis. And I'd never heard that before, but you know, go you. OR time, do you want it or do you not? Some people love surgery, some people hate it, absolutely hate it. Patient population, do you want peds? Do you want mainly women, mainly men? Ours are going to be a little bit older patients, generally speaking, but we do have some children, not children, but we do have some young adults. But if you don't want to be working with young adults, you know, or if you don't want to be, I don't know, working with women, maybe do cardiology, because there's so many male issues with the heart. Team dynamic matters so much. Are you going to be working with residents? Are you going to be working with other PAs? How's the relationship with nursing? How's the new grad training? Is it 3 weeks or is it 6 months? Like, you're actually going to want more because you want to be set up for success for you and your patients. And then finally, you know, leadership and career development opportunities. There's some of these jobs that I'm looking at that aren't really, that you just kind of are there and you don't really have much room for growth. But here, as we can see, you know, Artur has moved his way up to become the head preceptor of all the PA students at all of Lenox Hill Hospital, and he's hosting things like this. I know that there's been a lot of promotions and like changing up within the Lenox Hill neurosurgery PA department, and it's really cool to see that because they're actually promoting the growth of their PAs. And it's like, not only are you giving to the company, to the hospital, but they're giving back to you, which is super important. All right, that's my portion.
Sorry about the new extra soundtrack there. So thank you everybody for all that. And before we open up to a QA, you know, why should you want to be awesome, right? You know, why would you want to be a PA? And a lot of the talking points are mentioned here by many of us and these are some reasons, but not a complete list. And lifestyle, as Lindsay mentioned and other PAs mentioned, you can work 3 days a week, you can work 8 days a week. You know, it all depends on what you want to do, how much you want to learn, how much you want to make. We really don't have any, you know, cap on that. And, you know, you can choose your lifestyle as a PA, perhaps over other professions in general. Versatility is very important because if you want to do neurosurgery, but then do, you know, primary care the next day, cool, go for it. You know, you could do that as a per diem, as, you know, Lindsay mentioned as well. You can do another gig or even several gigs in different specialties. Now, I will say a lot of people find that, oh, well, I was a PA, I can change specialties all the time. That's true, but not necessarily completely realistic. I've been doing neurosurgery for what, 16 years now. And as you know, Christina mentioned, I go home every day thinking, gee, I don't know anything. Like, there's still so much to learn and to do. You're constantly learning because medicine's constantly evolving and medicine's really hard. So, you know, I think we do have flexibility to do other specialties. I just don't think you're going to do 5 specialties in 5 days because it's hard to really master something in that regard. You know, autonomy with limitations. You know, I think that's really important because as PAs, your role can differ based where you are, but we are pretty autonomous. There's a lot I can do without having to ask anybody. And on our team, we do a lot of bedside procedures, which are really, really cool. And we don't have to have somebody over our shoulder watching us. We always have a supervising physician though. And the benefit to that is, you know, as a PA, I don't have to worry about networking for business. I don't have to worry about insurance coverage for my patients or if I'm getting paid or malpractice because the hospital covers me. You know, there's certain things that are off our shoulders. We don't have to worry about as PAs. We can come, we can do medicine, we can have fun, we can learn, we can save lives, and we can go home. Okay. And I think that autonomy with limitations is actually a benefit, not necessarily a negative. And then the NP, MD, PA considerations. The bottom line is we're all awesome, right? All these professions are awesome. It's really about knowing what you want to do. There's a question here in the chat about the PA, MD bridge. I know maybe 2 PAs have done that. And those people, I think, just maybe they wanted to be MD up front and they got into PA school. And I know there was a chief resident last year who got into MD because she couldn't get into PA school, but that's where all the adaptability comes in. And so, you should understand that, yes, you can be a PA in 6 years, start to finish with a master's, and be a neurosurgery PA, but if you want to be a neurosurgical attending, you're looking at 12 to 15 years, that shouldn't limit any of you. Don't let the finances and time limit you on what you actually want to do and think you'll fit. The NP route, the education route's very different. You become a nurse and you go to NP school and you specialize in something, in critical care, primary care. So maybe there's a little less flexibility there than a PA, and definitely as an MD where you really stay this one thing. But all of these are awesome things. And then of course the time.
What I have to say about the MD-PA is that you still have to go through all 4 years of med school. You're basically taking 10 steps back to go back to med school and then going forward.
I agree. It's a completely different education path. And I don't recommend it unless you have lots of time and money about it, or you just want the loans. But it's not something I would do as a primary path. And finally, time versus money. And as mentioned here, you have to weigh which are important to you, but don't let anything restrict you, because these professions, you'll pay off your loans. It's not that big of a deal to get loans to do what you want to do, but it's still something you should consider. And finally, I want to end with this quote. I've been a PA for a long time, so I can read this, but for those of you who can't, I just want to summarize this quote as, whatever you do it with intention. And that's the bottom line. It doesn't matter if you want to be a PA, MD, or if you want to, be the president, whatever it is. As long as you do it with the intention and the right attitude, you'll be great at it. And that's, I think, the bottom line. And this is a very great quote that says that. And finally, and with that, I end, and we open up to Q&A and questions. I know there's been some in the chat already, but I don't, Ashley, if you want to guide us some questions, or if I should, for the duration of the time.
Yeah, I'm happy to filter it for you guys. Thank you so much for that presentation. We really appreciate having each one of you and like your unique perspective. I didn't know this was a readable quote. I thought it was just scribble. That's really funny. But that's a meme. So something I've been wondering, also thank you guys. I've been seeing that you've been answering questions as we've been going too. So thank you for doing that. But something I'm kind of still a little unsure about is how PA school actually works. Like what is the curriculum like for each year? What are you doing? I think I'm just so used to hearing the 2+2 for MD. That's how I know how it works, but I don't exactly know how PA school works. So I'd love to hear more about that.
I think it's 1+1 for PAs, but I think Christina or Lindsay, being our more junior members, would be best to tackle that question. Please.
Sure. Can you repeat the question?
Yeah, no problem. Yeah, sure. So I was just wondering how PA school works, what you do for each year. What's the curriculum like, stuff like that.
Okay, yeah, I can definitely speak on behalf of that, considering I'm in the thick of it right now. Well, almost, I think that's the tail end. So generally it's a 2 to 3 year program. It depends on the program. I picked it to only apply to 2-year ones because I was like, I'm going to be PA anyway, might as well get in, get out. And so then the first half of it, depending on how long it is, so mine was the first year, a little bit over, you have class from 9 to 5. Ours was in-house back when, pre-COVID, class from 9 to 5, and then you're studying every single day after that and on weekends. You're basically working 80 to 100 hours a week just on studying. And then while you're doing that, you have exams twice a week for the entire year. And then you have fake patients that you're seeing often, so that you get to start to prepare yourself for clinicals. And then you learn basically every specialty during that time. About every month or so, you change which specialty you're in, and you do an anatomy lab for it and everything. And then at the end of it, you'll have like a cumulative exam, and then you'll start your clinicals. So then clinicals for us are 9 rotations. I'm at Pace University. It's 9 rotations, 7 of which are mandatory for everyone, like in the whole country. And then 2 for us are elective. So I did neurosurgery, and then I did the cardiac, the CCU, both at Lenox Hill. And then during that time, it's very different. It's almost like you're working a new job every 5 weeks for the entire year. And you have to, make sure that you're on top of, asking questions, learning who the people are, learning what a PA role is in that type of specialty. And then the exams are a little bit different. Instead of twice a week or 3 times a week, you have them once at the end of every rotation, but you're also doing, lots of like questions and board prep all the way through. And then up until then you graduate, and then about 2 weeks after, you're eligible to take your boards. Generally, you want to take them as soon as possible, because that's when you know the most amount of information, because you've been preparing for this for so long. But then after that, then you're a PA certified if you pass your boards.
Got it. Thank you. That was like super comprehensive. I appreciate that, Lindsay. Thank you. Arthur, I don't know who you want to field this one, but Natalie asked, what is a typical day in the life as a PA?
Oh, that's very simple. Yeah, I tagged the Lenox Hill neurosurgery page at the last slide, just LHH _ neurosurgery. And we actually have done a few day in the life bits for you guys. I think they're quite amusing. Fatima and myself, I know, have done them. And I think you get a good gauge of sort of start to finish how the day goes. And, but it's hard to answer that as a broad answer, because it depends on what you do. But, if you work in a hospital environment, you're typically, you sign out with colleagues, you do chart. A lot of our work is redundant and repetitive, and that's important. I tell everybody, and this is very important, is we at work strive to be just like McDonald's. Okay. And what I mean by that is, if you go to a McDonald's in New York or California, you expect the same cheeseburger. And so you expect medicine to be standardized the same way. And so we do the same thing over and over again to keep safe. And that's chart checking, examining patients, repleting, ordering, consulting, seeing, educating, discharging, et cetera. It's a whole gamut of work. And a day in life is going to depend upon where you work. But again, go to the Instagram page for the Lenox Hill Neurosurgery, and you can watch a couple of bits of my colleagues and what we do.
Heard it here, guys. Go follow Lenox Hill Neurosurgery. This is another one. I think we've heard like such positive takes, but do you feel like you guys could share maybe some of the obstacles you face as a PA and the times when it's a little more difficult?
Yeah, I think Fatima and Alex would be good to answer those, because they're in the thick of it.
Yeah. I think, like we've all emphasized, it's such a positive, we all have such positive experiences. And, I think I can speak for everyone to say that we love our jobs. But I think one of the more difficult things, I think Lindsay was talking about this in the chat a little bit. Not everyone knows what a PA is. So I feel like, a lot of times I walk into the room and they think I'm a nurse or someone. And so I think, educating people on what a PA is and what our role is part of a challenge. And also because we're mid-level practitioners, we're going between in our environment, the surgeon and the patient. So while we do act independently and, we can put in orders and make plans for ourselves and plans for patients, and do procedures, you still have to keep in mind what the surgeon wants and what the surgeon's preferences are. And so every surgeon has different preferences. So sometimes balancing that can be challenging, but it's what we do. We're used to it. While that maybe is a little bit of a negative, it really doesn't, you know, impact my outlook on our jobs and what PAs do.
Yeah, so I wanted to add is that over time you are making more and more of an independent decision, which works perfectly because when you have just started, you don't know enough to make these decisions, and you actually feel grateful that you have always have an attending and a backup to like run things by. And more time passes, you actually do give suggestions, and that's where the satisfaction comes because they do take your suggestions seriously, and you basically make a decision as a team. A lot of the time when we round between the attendings and PAs, we have a discussion and we make a combined joint decision. So you don't really always feel like you're being told what to do. And you, on top of it, you always have that backup, like let your attending know what you're doing, so you're not completely on your own.
Thank you guys. We appreciate that. We appreciate your honesty. It's been so great having you here. We just have like another minute left. Arthur, thank you so much for organizing this. This is such a great panel. And yeah, I mean, I think, is there any last comments you have or anything you want to say?
Looking at the question sections, I think a lot of people have lots of good questions that we would like to discuss. So, maybe we can do a separate panel and, let all our brain turns know that this is happening, and we can just do it as a question answer session.
Yeah, I can do that. I can also take some of the questions from the chat and or like put it out there that anyone can ask questions and like find a way to send them over to you guys. But that's a great idea, and we can look to do that for sure, Fatima.
Yeah, I think a few of us looked at our emails in the chat, might have gotten lost in all the messages, but feel free to reach out to us if you guys think of anything else.
Yeah, thank you for the audience for coming. I know the docs are really fun and interesting, but we have fun too. So, I think some of us put our emails. Feel free to touch base with us if you have any outstanding questions. We're happy to answer them. We're PAs are one big family. We take care of each other, and so not that we don't take care of everybody, but again, we're all awesome. That's the end point.